Here is a detailed explanation of vaginal infection. 1. Introduction. Vaginal infections are a widespread health issue among women of all ages and are among the most common reasons for gynecological consultations. They can significantly affect a woman's quality of life, causing discomfort, embarrassment, and reproductive health complications. Most infections are treatable, especially when diagnosed early, but recurrent or untreated cases can lead to serious outcomes. 2. Definition. Vaginal infections are diseases caused by the overgrowth of pathogenic organisms, bacteria, fungi, parasites, or viruses in the vaginal canal, leading to inflammation and symptoms such as discharge, itching, and discomfort. These infections disturb the normal vaginal flora, which consists mainly of lactobacilli that help maintain an acidic pH. 3. Etymology. Vagina, from Latin vagina, meaning sheath or scabbard. Infection, from Latin meaning to taint or spoil. Together, vaginal infection refers to an invasion or imbalance of microorganisms in the vaginal canal. 4. Epidemiology. Global prevalence. Bacterial vaginosis, BV, most common, affecting 20 to 30% of women worldwide. Vulvovaginal candidiasis, VVC, affects up to 75% of women at least once. Trichomoniasis, an estimated 156 million new cases occur annually. Age factor, more common in women of reproductive age. Socioeconomic factors, poor access to healthcare and lack of awareness increase risk. Geography, higher rates in developing countries due to lack of hygiene and medical resources. 5. Types. 1. Bacterial vaginosis, BV, overgrowth of anaerobic bacteria replacing normal lactobacilli. 2. Candidiasis, yeast infection, overgrowth of Candida albicans. 3. Trichomoniasis, caused by the parasite Trichomonas vaginalis. 4. Chlamydia and gonorrhea, sexually transmitted bacterial infections affecting the vagina. 5. Viral infections, e.g. herpes simplex virus, HSV, human papillomavirus, HPV. 6. Atrophic vaginitis, thinning and drying of the vaginal walls due to estrogen deficiency, often postmenopausal. 6. Causes, bacterial imbalance, loss of protective lactobacilli. Fungal overgrowth, especially Candida albicans. Sexual transmission, trichomoniasis, herpes, HPV, chlamydia, gonorrhea. Hormonal changes, pregnancy, menopause, or menstruation. Antibiotic use disrupts normal flora. Poor hygiene, use of scented soaps, douching. Tight or synthetic clothing promotes a moist environment for pathogens. 7. Risk factors, multiple sexual partners. Unprotected sexual intercourse, use of intrauterine devices, IUDs, use of broad-spectrum antibiotics, diabetes mellitus, weakened immune system, e.g. HIV, pregnancy and hormonal contraceptives, poor vaginal hygiene practices. 8. Complications, pelvic inflammatory disease, PID, infertility, increased risk of miscarriage or premature delivery, neonatal infections, higher susceptibility to HIV and other STIs, recurrent infections, cervical dysplasia with viral infections. 9. Pathophysiology step-by-step process. Normal vaginal environment, dominated by lactobacilli producing lactic acid, maintaining pH 3.8 to 4.5. Step 1. Disruption in vaginal flora, causes antibiotics, hormonal changes, poor hygiene, sex, etc. Step 2. Overgrowth of pathogenic organisms, e.g. Gardnerella vaginalis, Candida albicans, Trichomonas. Step 3. Inflammatory response. Immune cells migrate, cytokine release, inflammation. Step 4. Symptom development, discharge, odor, itching, pain, burning sensation. Step 5. Potential systemic involvement if untreated, ascending infection, PID, infertility. 10. Signs and symptoms. Bacterial vaginosis, thin gray-white discharge, fishy odor. Yeast infection, thick white cottage cheese discharge, intense itching. Trichomoniasis, frothy yellow-green discharge, vaginal soreness, odor. HSV, painful ulcers or blisters on genitalia. HPV, genital warts, abnormal pap smear results. General symptoms, burning sensation during urination, painful intercourse, dyspareunia, redness, swelling of vulva, vagina. 11. Diagnosis, history and physical exam, vaginal pH test, 4.5 in BV and trichomoniasis, normal in yeast infection. Microscopy, wet mount clue cells, BV, motile trichomonads, yeast buds. Whiff test, fishy odor after adding KOH positive in BV. Nucleic acid amplification tests, VATS, for STIs, detects HPV in abnormal cells. 12. Nursing diagnosis. Impaired comfort related to itching and discharge. Risk for infection related to altered vaginal flora. Deficient knowledge regarding personal hygiene. Disturbed body image related to symptoms. Anxiety related to fear of serious illness. 13. Medical management. Bacterial vaginosis. Metronidazole or clindamycin, oral or vaginal. Candidiasis. Fluconazole, oral or miconazole, topical. Trichomoniasis, metronidazole, treat both partners. Acyclovir, valacyclovir antiviral. HPV, cryotherapy, laser therapy, or topical agents. 14. Nursing management. Educate on medication use and completion. Encourage proper perineal hygiene. Promote wearing breathable cotton underwear. Counsel regarding sexual abstinence during treatment. Assist in partner notification for STIs. Emotional support to reduce anxiety and embarrassment. Number 15. Treatment options. Pharmacological. Antifungals, antibiotics, antivirals. Non-pharmacological, sitz baths, probiotic supplements, avoiding irritants, scented soaps, tight clothing. Surgical, rare, for extensive warts or resistant HSV ulcers. 16. 5 psychosocial interventions. 1. Counseling and reassurance, to address emotional distress and misconceptions. 2. Support groups, for women with recurrent infections or STIs. 3. Sexual health education, promoting safe sex practices. 4. Partner involvement, addressing relationship concerns and shared responsibility. 5. Cultural sensitivity, respecting beliefs while educating about hygiene and sexual health. 17. Prevention, practice safe sex, use condoms, avoid douching or scented vaginal products, maintain good personal hygiene, wear loose-fitting, breathable underwear, wipe front to back after using the toilet, regular gynecological checkups, prompt treatment of infections and managing chronic diseases, e.g., diabetes. 18. Conclusion. Vaginal infections, though common, are preventable and treatable with timely medical care, education, and healthy practices. Empowering women through awareness, early detection, and supportive care is essential in reducing the burden of these infections and promoting reproductive health and overall well-being. Thank you. Have a nice day.